It's 9 a.m. and you're watching Fox 31's Good Day Colorado with Shaul Turner, Ken Clark, and meteorologist Crystal Egger.
Singers are tough on their vocal cords, and until now, there were no easy ways to treat damaged voices. Coming up, a doctor joins us with a breakthrough Botox for vocal cords. He'll explain.
Botox, you know it's used to get rid of wrinkles, but now it could actually help save your voice. Find out how. It's really interesting. Those are vocal cords we're showing you right there. You know, how many times did we talk about Botox here on Good Day? I mean, honestly, Crystal, how many times have we brought it up? Yeah, it's always about wrinkles and stuff like that, but this is really unique. When doctors first started using Botox, it was a breakthrough in the treatment of lines and wrinkles. Now, another breakthrough, doctors are using Botox to save our voices. One specialist using this technology, Dr. David Opperman, with the Colorado Voice Clinic and Rose Medical Center. And one of the singers he's helping, Molly Kaufman, is 14 years old, has a bright career ahead of her. But Molly, one day, the sound just wasn't coming out, right?
Yeah.
What happened? You couldn't hold a note, I understand.
It was just, I had nodules on my vocal cords, so it was really hard for me to get up high there, and so it was just difficult for me to sing.
Right. So, doctor, your theory was that she had to lose her voice before she could heal her voice.
Well, Molly came to my office after going through a long, extensive period with voice therapy, which is the primary treatment for vocal fold nodules. However, she had the insight into her own personality and knew this is a 14-year-old girl with a cell phone, really large group of active friends, talking all the time. She knew there was no way she was going to obey voice rest for a 3 to 4 month period to heal.
Right.
So she came in asking for help. So what we did was talk about one of the options, which is actually using Botox to weaken the muscles in the voice and prevent the contact forces between the two vocal folds and thereby allow the voice to heal.
Okay. And this is going to be easier on the patient, ultimately.
Ultimately, it's essentially forced voice rest, which she was willing to go through in an attempt to regain her voice.
So we have some photographs here. Now, these are vocal cords. If you haven't seen them before, you may be saying, oh my goodness, what is that? But those are what your vocal cords look like. All of us have them. So what are we looking at beforehand?
What you can see in the middle of the screen, the white callus-like bumps on the vocal folds are the nodules, and these should not be there. The tissue should be nice and bone white in color and smooth.
Okay.
This is the after shot 3 months later after voice rest, and you can see they're approximately 95% gone.
Wow.
The key story here is that Botox took her from the before to now, and she still has to continue with voice therapy to make these 100%.
And this took how long? The whole
3 months.
3 months. So how did it feel, Molly, when your vocal cords went from the picture on the left to the picture on the right?
I mean, from the beginning, it was like, it was raspy and horrible sounding, to after it was like clear and nice to talk, instead of sounding like you're like a 50-year-old smoker walking around.
Wow, because you've got some big career aspirations. You want to be a pop singer, maybe?
Yeah.
Yeah, and you need your vocal cords for that. Did you feel funny that Botox was being injected into your vocal cords?
It was weird.
It was kind of weird. Well, I mean, Botox just seems like, you know, it's gotten criticism and it's gotten praise. What do you think the next use is going to be for this Botox?
Well, I think we're learning more and more about what its limitations are and what advances can be made with it.
Yeah.
You know, using it for laryngeal abnormalities is still an off-label use.
Right.
But what this has shown is that we're able to weaken muscles that we need to weaken if there's spasms involved, or in her case, to try and allow her to heal.
Right.
There are studies out that show it can be used on facial injuries with scarring to actually decrease tension in the skin and let scars form with a less degree of severity.
Oh, I can imagine. We'll be doing many more shows on Botox
Much
here.
more.
It's so popular. Well, thank you so much, Dr.
Thank you.
Opperman. And Molly Kaufman, good luck to you in your singing career. Hopefully you'll come back on next time and sing for us.
Yeah, maybe.
Put out your first CD. And for more information about the Colorado Voice Clinic and Dr. Opperman, you can go to our website, myfoxcolorado.com. Look for the S seen on tab under Good Day. Learn more about that Botox, too.